Hi, I'm Lori Handy. I'll be speaking to you today from the Vaccine Education Center at CHOP. Today, we'll be talking about the rotavirus vaccine and why it's important to start this vaccine on time. What parents may not actually realize about the rotavirus vaccine is that if we don't start the vaccine on time, we may not be able to give it to your baby at all. Let's back up and talk about what rotavirus is. This is a virus that causes the typical stomach bug, high fever, vomiting, and diarrhea. For babies, however, this can be quite severe as it leads to dehydration and they have a hard time rehydrating themselves while they're so sick. In fact, before we had rotavirus vaccines, we would have about 70,000 children per year end up in the hospital due to the illness. For the past 20 years, though, we've used this vaccine and seen a significant decrease in disease. So let's talk about timing of the vaccine. The vaccine really needs to be given at 2 months of age, though the first dose can be given as late as 15 weeks old. It needs to be completed, the entire series, by 8 months of age. The reason that it's given this way is this is the regimen in which we have the most safety data, and it's also the way to ensure babies are protected at the time when they are the most vulnerable. Looking at the safety data, there is a rare complication of both rotavirus disease and the vaccine called intussusception. What we've learned over the past 2 decades is that this very rare complication actually was part of the viral infection itself. Compared to the time before we had vaccine, we now know that 9 out of 10 children who are vaccinated will be protected from severe disease, and 7 out of 10 children will be protected from any disease at all. This is welcome news for parents. Thank you for taking the time to listen today.